If you're a man and you have diabetes, then this video is for you, because in this video I'm going to be covering a topic that, to be honest, is rarely talked about, but it's a huge problem, and that's sex in the context of diabetes for men. As you'll know better than most, diabetes is a significant health condition globally, affecting millions of lives, not only physically, but also emotionally. And for men who have diabetes, issues surrounding sex can be a common and really big problem. The issue is that because men can be embarrassed talking about this topic, it's rarely spoken about. But in this video, we're going to change that. I want to start off by saying there's nothing to be embarrassed about. What you're going through is actually really common, and you'd be surprised at how many other men are going through this same problem. I'm hoping that by the end of the video, you're going to feel more confident and comfortable to talk to your partner openly about the problems you might be having, your doctor or health provider, and finally feel more informed about what the problems are and what treatment options are available to you. So let's start with some of the problems you might be facing in the bedroom. You might have noticed reduced sex drive, difficulties with getting an erection, problems with ejaculation, pain during sex, and just overall decreased sexual satisfaction. It's also important for me to mention that these issues are not just physical. They deeply affect psychological well-being and relationships. Now, whilst the physical symptoms are probably the ones that come to the top of your mind, I'd like us just to acknowledge that the psychological impact of diabetes on sexual health can be just as profound. Many men report feelings of decreased self-worth, attractiveness, and even bouts of depression and anxiety, which can further complicate their sexual health. Now, if you couple this with the visible signs of diabetes management, so things like insulin pumps, skin blood glucose monitors, or scarring from injections, this can also affect body image and self-esteem. So now we've covered some of the sexual health problems, what would be my advice for trying to address some of these problems? Well, the first thing to say is that talking about it is so important. It's crucial to maintain open lines of communication with your partner. Discussions about the problems you're facing should be honest, and they should occur without time pressure. Now, if direct conversation feels too daunting, writing down thoughts and concerns to share with your partner could also be an effective option for you to think about. You might also feel more comfortable going to speak to someone like me, your doctor, confidentially about this first, and then maybe making a separate appointment to bring your partner along with you once you feel like you've been more comfortable and confident to broach the subject initially. The second really important thing is making sure that you're managing your blood glucose levels well and trying to keep your blood pressure and cholesterol in check. If you're struggling with this and want to try find some motivation or come up with a plan to try tackle this, make an appointment with your health provider. Now, alongside communication and talking openly about the problems you're having and keeping on top of your blood sugar control, the other good news is that there are medications also available. Now, tablet medications like sildenafil, which you might know as Viagra, and tadalafil have been effective for many people with diabetes, and these can help if you're struggling to get or maintain an erection. They work by enhancing blood flow and enabling erections when sexually stimulated, but it's really important to note that in order for them to be effective, you need mentally to be in the right headspace, which is why the psychological issues that might be affecting you are so important, if not more important, to address. Now, other options aside from medications can also include penile injections as well as vacuums, which help to achieve an erection by creating a vacuum around the penis, which is a preferred method for those who are wanting to avoid taking medications. Finally, diabetes community support groups, both either online or in person, can provide invaluable emotional support, as well as practical tips from those who are sharing similar experiences. And I've included some really useful links in the description box of the video for you if you're interested in these. I hope you found this video helpful, and remember, problems with sex and diabetes are really common and nothing to be embarrassed about. You certainly aren't alone, and I hope this video has given you the confidence to talk openly and honestly about it, and that you can find the help that you need. Thanks for watching, and until next time, bye.